I'm Shannon, and today my group members and I, Jenna and Nate, will be presenting to you what we think was Ana Garcia's cause of death. Ana Garcia was a 38-year-old Hispanic woman. She was 64 inches tall, which is 5 foot 4 inches, and she weighed 165 pounds. She was sent for glucose tolerance testing at the age of 14 and tested positive for type 1 diabetes. Her family has a history of heart disease and uncontrolled hypertension, and her father had a heart attack at the age of 41. She tested positive for sickle cell at 4 months old, and she just recently had a UTI. It was 92 degrees on a summer morning when the emergency call came in at 9:45 from Anna's neighbor, Doug Green. He had heard her usually quiet dog barking excitedly for the last 2 hours and decided it would be a good idea to call or ring the doorbell to see if she was okay. With no answer, he decided to call 911. The last time he saw her was the previous morning, walking her dog at 6:30 in the morning in a pantsuit during a heat wave. We believe that Ana Garcia died of a heart attack. A heart attack is when the blood flow to your heart is blocked, causing a lack of oxygen. This video here will go more into depth as to what a heart attack is and how it is most likely caused.
Blood flows from your aorta through the coronary arteries to supply your heart muscle with oxygen and nutrients. During your heart attack, blood flow through one of your coronary arteries may have been severely reduced or completely blocked. Your reduced blood flow may have been caused by a buildup of a fatty substance called plaque in your coronary arteries. If this plaque became disrupted, a blood clot might form and severely worsen the narrowing, or lead to a sudden, complete blockage, stopping blood flow down the artery. A blockage in your coronary arteries prevented the oxygen and nutrients in your blood from reaching the part of your heart supplied by the artery. As a result, heart muscle in that area started to die. Damage to part of your heart muscle is called a heart attack.
There is a lot of evidence that proves that Ana died from a heart attack. To start off, an examination of her heart showed left ventricular hypertrophy. This is the enlargement and thickening of the heart's main pumping chamber, the left ventricle. This would have caused her heart to work harder than it previously would have. This likely developed from her heart disease and her high blood pressure. The examination also revealed evidence of mild mitral valve prolapse. This is when the mitral valve doesn't close properly, which could let blood back into the atrium and damage valves, causing the heart to be unable to pump blood. There is also scar tissue and clots blocking the left anterior descending coronary artery. This artery is sometimes known as the widowmaker. Because it becomes partially or completely blocked, there is a high risk of death by heart attack. The right coronary artery is also 80% blocked, and there is narrowing noted in the renal arteries and the cerebral arteries, which provides evidence of atherosclerosis. This is the hardening and narrowing of arteries, and one of the usual causes of a heart attack, since it puts blood flow at risk as the arteries become more and more blocked. Her high cholesterol, hypertension, and plaque buildup in her vessels could have made them weaker and restricted her blood flow. Her fingerprints show substantial graying, which shows there was a lack of oxygen, and the vomit was most likely a result of the heart attack. Sickle cell causes the red blood cells to be misshapen, which makes it harder for oxygen to attach them, which is another reason there might not have been enough oxygen in the blood. When investigating the crime scene, we use the zone method. First, the scene will be closed off to make sure that none of the evidence will be disturbed. The evidence will be tagged numerically, and pictures of the scene will be taken. Samples of blood, hair, vomit, meds, unknown substances, bodily fluids, and more will be taken. The body is taken by the coroner, and then the toxicologist will perform tests on the samples that were taken previously. The medical examiner will study the body for clues to find out what killed them. Here we have some pictures that were taken of the crime scene. The first two pictures show the bloody footprint, the blood on the fallen desk, and the Humalog insulin pen. The ones at the bottom show the entire body, as well as the knocked over cup of Snapple and the vomit. The evidence we marked goes as followed. 1, the vomit. 2, the first pill. 3, the bloody footprint. 4, the blood on the desk. 5, the spilled cup. 6, 7, 8, 9, and 10 are the rest of the pills. 11, the Humalog insulin pen. 12, the hair. And 13, the fingerprint on the desk. Here we have careers that Ana would have come into contact with before and after her death. For her heart disease, we have a cardiologist. A cardiologist is a doctor with special training and skill in finding, treating, and preventing diseases of the cardiovascular system. They carry out tests and some procedures. For her sickle cell, we would have a hematologist. Anna went to one of these a lot throughout her life to help manage her sickle cell anemia. They are a doctor that specializes in blood, blood-forming organs, and blood diseases, which for Anna, obviously, would have been her sickle cell. Then for diabetes, we have a dietitian. They're someone who advised Anna on what to eat in order to lead a healthy lifestyle, although she might have not always followed what they said. Again, for diabetes, we have an endocrinologist. They specialize in the glands of the hormone system, which in Anna's case would have been her pancreas. They helped Anna manage her diabetes throughout her life. Then for UTI, we have a primary care physician. They're just your average family doctor that Anna probably went to when she was diagnosed with a UTI. Then we have a urologist. They're a physician that specializes in diseases of the urinary tract and who probably helped treat Anna's UTI. Then we start off with postmortem. We have a toxicologist. They're someone who would perform tests on bodily fluids, tissue samples, and drugs that were at the scene of Anna's death. Then we have a crime scene investigator. They collect and examine evidence at the crime scene to determine important info in order to solve the case. Then we have a forensic pathologist. They're a specialist that performs the autopsy to determine the cause of death, whether it be natural, accidental, homicide, suicide, or unknown. In Anna's case, it would have been a natural death. Then finally, we have a blood splatter analyst. They collect and analyze the blood's location and shape at a crime scene. As I previously stated in the introduction slide, Anna went for a glucose tolerance test at the age of 14 and was diagnosed with type 1 diabetes. Type 1 diabetes is when the pancreas has a hard time making insulin, resulting in high glucose levels. Because of this, Anna had to watch her diet a lot more. She had to stay away from high fat and sugary foods, although she did not really do that closer to her death. Her blood sugar levels could have been kept in normal range if she took her insulin as directed, ate, and exercised healthily. She experienced many of the negative symptoms of type 1 diabetes all throughout her life. This includes tingling in her legs, fatigue, thirst, frequent urination, plaque buildup, receding gums, clouded vision, swollen blood vessels in her eyes, as well as bad kidneys and ketones in her urine. This negatively affected the urinary system because the kidneys were forced to work harder to diminish the sugars in her blood. It also affected the nervous system because it destroyed the nerves all throughout her body due to constant high blood sugar levels.
Anna Garcia's diet. Throughout Anna's life, she has been told to keep a food diary. She has been told to keep a food diary because she suffers from type 1 diabetes and other different diseases. Days before Anna Garcia had died, she had had a fairly healthy diet. Even though every night after work, Anna would come home and drink 3 glasses of wine, which for her is not the best thing. On the night before Anna had died, she had consumed a lot of junk food. This junk food had included 2 slices of thick crust pepperoni pizza, 2 cups of tossed salad, 4 tablespoons of Caesar dressing, 1 cup of vanilla ice cream with half a cup of mini marshmallows, and 5 Oreos. Hypercholesterolemia. Hypercholesterolemia is a high amount of cholesterol in a person's blood flow. With hypercholesterolemia, it can limit a person's blood flow, which can increase the chances of having a heart attack. The last time Anna attended a doctor, they had done a full cholesterol panel. When they had done the full cholesterol panel, they had tested her total cholesterol, her low-density lipoprotein, and her high-density lipoprotein. Anna's total cholesterol was 389 mg. For a normal person of Anna's age, it should be 200 mg. Next, her low-density lipoprotein was 243. For a normal person of Anna's age, it should be 100. Lastly, her high-density lipoprotein is 60. Again, a person of Anna's age should be around 50 to 60. Anna and her father both suffered from hypercholesterolemia. At age 41, Anna's father had died of a heart attack. Sickle cell anemia. Sickle cell anemia is a group of disordered red blood cells. The red blood cells are in a sickled shape. The cells die early and can cause a shortage of healthy blood cells. It can cause blockage in the veins and can cause pain. Anna Garcia had been diagnosed with sickle cell anemia at 4 months old. On top of hypercholesterolemia, type 1 diabetes, and sickle cell anemia, Anna had also suffered from heart disease. Heart disease is a condition that includes diseased vessels, structural problems, and blood clots. Just like her father, Anna was diagnosed with heart disease. With hypercholesterolemia and sickle cell anemia may have caused Anna's diseased vessels or structural problems to cause blood clots, which may have stopped the blood flow to Anna's heart, which may have caused her to suffer from a heart attack just like her father.
UTI. Urinary tract infection is infection in any part of your urinary system. This includes ureters, bladder, kidneys, and urethra. Women are at greater risk of attaining this infection. Some symptoms are increased urge to urinate, pelvic pain and pain with urination, and blood in urine. This can lead to a kidney failure if it reaches that point. Anna's urinary tract infection escalated to sepsis, which caused inflammation that led to an organ failure. There was also inflammation in the urinary system because of the infection. But their kidney, already damaged from years of type 1 diabetes, made this even worse. The flow of oxygen throughout her body lessened, causing organ failure, and affected the entire body. Drugs. ACE inhibitor. This is a heart medication that widens or dilates your blood vessels. Antibiotics for UTI includes Levaquin, Cyproquin, and etc. Destroys or slows down the growth of bacteria. Hydroxyurea for sickle cell increases the amount of fetal hemoglobin in red blood cells. This also helps red blood cells stay around and travel through the tiny blood vessels. Her insulin shots for diabetes. This helps control blood glucose in people with type 1 diabetes. Aspirin treats fevers, headaches, and inflammation. Could reduce the risk of a heart attack. Arthritis medication for her hip. Is anti-inflammatory drugs like ibuprofen, Advil, Motrin, and more. Connections. At 14 months, she was tested positive for sickle cell anemia with symptoms of sickle cell disease, also diagnosed with type 1 diabetes. Age 10, sickle cell disease is still present. Her spleen is not working properly. With her spleen not working properly, she has an increased risk of infection because of her body can't fight off the bacteria. At age 17, has acute chest syndrome, and she cannot breathe properly. This causes a lot of pain in the chest and is caused by infection of or blockage of blood flow to the chest and lungs. Sickle cell anemia blocks her blood flow throughout the body, taking hydroxyurea, and she is given insulin shots. At age 22, she needs a hip replacement. The artery is blocked. That gives blood to the bone. Age 31, still has sickle cell disease. Hip replacement went good. At age 37, she goes off track on her diet and doesn't exercise. And with people with type 1 diabetes, this puts them in huge risk of heart disease and heart attacks and other cardiovascular complications. Kill about 3 out of 4 people with type 1 diabetes. And on top of that, she has a history of heart disease in her family. She's also tachycardiac. She has a little heart murmur and has signs of high cholesterol levels. At her death, they found a plaque in her artery. Frontal lobe of the brain is a blood clot, and she also has lost a lot of oxygen to her brain. Here's the reenactment video. We're excited.